Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining us as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Matt Blosl, CEO at Dexcare. Matt, welcome to the show.
Thank you. It's a pleasure to be here. Look forward to the discussion.
So, Matt, what I always like to do before getting into the main part of the conversation is to give my guests a chance to provide more of an introduction in terms of who they are and what they do. So, Matt, the floor is yours.
Sure. For probably the last 20, 25 years, I've really kind of been in the same space of working with venture or private equity-backed businesses to help them scale. And this is Dexcare is my second foray into healthcare. I actually started in healthcare about 12 years ago, where I was with a company that eventually became Experity in the urgent care space. And healthcare is something I never thought I would get into. My wife is a physician. I hadn't worked in the vertical until I was recruited into the urgent care business, and I've loved it ever since.
So kind of with that unexpected shift into healthcare, what got you into it other than the recruitment, or kind of what was it about the recruitment that pulled you in?
It's a great question. You know, what I like to do, I love to come into businesses when they're at an inflection point. You know, we always point the growth of businesses as this smooth curve up and to the right. And in reality, it's a stair-step function, right? And as soon as you get to the top of one step, you're at the bottom of the next. And so I like to come into businesses where, you know, there is a lot of that maturation that needs to happen. And the good thing about healthcare is it's extremely complex. And so all of the companies, certainly technology companies that are supporting it, frankly, have to reinvent themselves every 2 to 3 years as the landscape changes. So for a guy that likes to build and scale companies, healthcare is an exciting place to be.
And kind of focusing on the building and scaling, you know, I know you said your first foray was in the urgent care space, but what are you focused on now?
Yeah, at Dexcare, it's interesting. You know, before I worked, primarily, with independent urgent care clinics, helping basically power their business with electronic medical records, full revenue cycle management. Now I've shifted, and what we do at Dexcare is work with large health systems, frankly, the largest in the country, on care orchestration, which, really comes down to how do we get patients to the front door and how do we get them paired with the right provider. And so while it's still healthcare, it's very interesting, the scale difference now in dealing with large health systems versus, independent urgent care operators of various sizes. They could have had 1-2 clinics all the way up to a couple hundred, but the scale of Dexcare and the clients and what we're doing is really exciting.
So when you talk about care orchestration, and you just said it's kind of that combination of how do you get the patient to the door, and then how do you get them paired to the right clinician or the right physician? It's, I suspect that is a very great simplification of what that really means. So when you're thinking of care orchestration, kind of what is that kind of more complete definition, or the granular view of what it means?
Yeah, I thought you were going to go the opposite direction. I always say, if I was to describe Dexcare to my mother, I tell her we're the Match.com for patients and providers. But going the other direction, a little more sophisticated. Listen, when you think about the two sides of that, let's just call it a transaction for lack of better terms. The first is, how do we make the discovery of the care they need easier to patients, right? And so it's not just bringing traffic to the front door, right? It's really around how do we get people to have a seamless experience with going and finding healthcare. We think about other industries, whether it's booking a flight, whether it's purchasing a product, on Amazon.com. Those experiences are have evolved, and they're seamless, and they're quick, and they're informative. We want to do the same thing and do that with our health system partners, so that access to care or the right place to go to find the care you need is available to patients. And then the other side of the transaction, when you think about the providers, That's the more complex one. When you think about a large health system, there is a lot of data, logic, and systems that go into finding the right provider based on, what the patient is looking for. And so we work with health systems to deal with that complexity. And in an ideal world, we should have snowflake to snowflake, right? We should have a patient with very, very unique needs, and we should know the optimal provider within the health system on which to pair them with. That's easier said than done, given to the complexity of health systems. So we work with our partners to really develop somewhat of a bespoke solution based on their unique priorities, workflows, systems that that health system has.
Yeah, and kind of as you said, there's probably a lot of complexity in there, but it's as you're developing those customizations and working with each customer, maybe before you even get to that point, it's like what does the traditional pathway look like? Have the systems done anything to make it easier to make that discovery and matching process occur, or has it been kind of traditionally a bit of blind luck?
Well, listen, there's definitely progress that's been made, but it really kind of, in my mind, goes in phases. The first was in the way a lot you see it exist a lot today is there's a lot of efficiency that is within the health system, but it's typically siloed and departmental, right? Orthopedics has figured out how to do the right things to make the workflow there as seamless as possible. And then primary care has done the same thing. But what hasn't really happened is the orchestration across the different silos, across the different departments. And that's really where Dexcare comes in because, with technology today, our ability to connect systems, move data around, intelligently look at that data, even proactively, it allows us to give the health systems the ability to step back, look system wide, and connect all of those what historically would be silos and make it really appear as one entity, right? And that allows them to really serve up the right provider at the right time.
And kind of as you said, if each kind of department was doing it in their own way and had developed their own processes, what are some of the challenges that you've seen and helped to overcome to create that unified process? And it seems like the ideal state is getting them all following the same pathway and the same workflow.
It's a great question. It's something we talk to our health system partners about all the time. We can leverage the technology to get the data and the intelligence so far, but there has to be a willingness of the health systems to change their processes. And that's very difficult, right? I mean, we just know historically, the healthcare ecosystem, because of the risks associated with it, they're not always the quickest to change. And so what we do find at times is we can connect the data, we can connect the systems, we can offer up the most intelligent solution, but they have to be willing to make changes to how they operate, right? Otherwise, it's just business as usual. We have data that tells us what we should do, but we might not be leveraging it to its fullest potential. So that is probably the most significant challenge that we face is that technology can't solve it on its own. You also have to adapt the processes and how you go about, serving patients or serving providers up or, treating patients.
Yeah, and kind of I think as you're hinting at, that behavior change is one of the more difficult things to achieve. But I suspect you also probably have seen, practices or approaches that drive success and getting people to be more willing to follow through on that change. So, I don't know if you have any examples that you might be able to give that you might throw out there to, when you're working with folks that get them to understand what the positive impact would be of maybe just taking that first step and being able to see how this new process can change things for the positive.
Yeah, and it's interesting. What we see at a lot of our clients, for example, is that they have a lot of unused capacity. Providers maybe the administrators think that, oh, all of our physicians are fully booked, right? We need more physicians. When in reality, when you look at the actual available slots, you may realize that there's 30% of appointment slots that are being unused. And so what we find is that we can come in, speak to something that we know that they're going to want to hear, which is we'll help you see more patients, which will allow you to deliver more care, which then obviously has a downstream effect of more revenue for the system, more compensation for the individual. We can come in, help unlock that additional available capacity that they just can't see, right? Because of the siloed nature, because of the lack of connectivity of the systems. So we can come in there, unlock, let's say 30% of their available slots that are available. And so we can increase their business without hiring any additional people, just getting them to operate more efficiently. And we see that all the time. And the beauty of Dexcare is those results are immediate. We especially in that, use case scenario, is that it doesn't take 6 months to start to see the results. Literally days after implementing the Dexcare platform, you will see an increase in the number of appointments booked without hiring additional providers.
Yeah, no, and I think probably anytime you can show greater efficiency and greater, kind of smarter utilization of resources, that's going to be a pretty easy argument because it appeals to everybody. And let you respond to that point.
You'd think so, right? Because when you think about it, especially given everything going on in the macroeconomic environment, in the political environment, and the impact that's having on health systems, the thing that I hear from the industry every day is that we're challenged to do more with less, right? And we call it the trilemma here at Dexcare, which is there's more patients that need care, there's fewer providers, and kind of summarizing it, there's less margin available, right? Costs are higher. And that trilemma, you'd think alone would drive people to see we need to change. However, it's tough when certain, staff has been doing things the same way for decades. Even with that carrot of being able to drive results that are better for the patient and for the provider, it's tough. I mean, it's human nature. So that's something that's why it's really important for us. We tend to work with the leadership level initially at most healthcare organizations because we need that buy-in and we need that culture of adapting to change, continuous improvement. And there's a lot of them out there.
Yeah, and kind of focusing on, as you just said, on buy-in and the willingness to engage in that change. It's I feel like that's a pretty universal point. It's if you don't have people understanding and wanting to follow through on the process, as you were saying, you're just going to have that innate pushback because it's very easy to stay with how you've been doing things for as long as you've been doing it. And for those of you just joining, I'm talking to Matt Blosl from Dexcare, talking a lot about care orchestration and optimization. And it's Matt, kind of picking up on that last point around the institutional inertia. Kind of what are maybe some of the tricks that you've seen to respond when you're getting that pushback? And maybe, I don't know if there's like kind of certain ways where you just show someone like this tweak in your workflow isn't actually like a significant change in what you're doing, but it's going to, maybe kind of be an easier thing for you to do, or, you're going to see that it alleviates different types of pressures from, kind of downstream actions that you would usually have to follow.
That's a challenging question. Obviously, it's very dependent on the client. Like I said, getting the leadership buy-in is probably, first and foremost. Second, being very prescriptive on how change needs to happen and the benefits of it, being very, very prescriptive. And so that's why what we do when we get into a new health system, we spend a lot of time understanding the current workflow so that we know what the gap is going to be, right, between where they are today and where they could be harnessing the Dexcare solution. So, and to do that, what we do is we have a team of former clinicians, right? Doctors, nurses, and that's a really important team because it's someone that has empathy and can speak the language of our clients. And so that team is very critical to our organization because they can partner with the technologist who says, well, this is easy. Now you can do this. But understanding what does that mean in a clinical setting, right? Because there's often things that we're not considering as, technologists, which is, yes, that seems like a very easy, more efficient way to do it, but maybe it introduces more risk or more uncertainty. And so there's angles that are really important that we really get into the head and the role of our client. And so that team and that view of things at Dexcare is really, really important so that we ensure that we're doing, not only are we advancing what they can do in terms of innovation, but we're doing it in a way that makes sense given, their environment, their priorities, their risk tolerance, et cetera.
And that's a really great point because it's, I feel like so often you hear companies need to find a way to get clinician involvement in the design process. And, as you described, having that team of clinicians internally to help interact with the engineers and the technology development side of it, was there a particular point or event that caused you to go in that direction? And, how were you able to develop that team internally?
Yeah, it's interesting. I've, done it here at Dexcare and then also in my previous organization in urgent care Xperity. I think it started very much with what you said, which is in the early stages of product development, where you're brainstorming different things in which you can do to impact the client, but not being a clinician ourselves, we start to ask questions. I find that starts with asking clients, and then over time you realize, wait a second, we would benefit from having somebody run Copilot with our product organization to really ensure that this is a technology solution that makes right for the setting it's going to be. But then I think it was honestly just experience for me that saw when you get to the implementation process and you're actually there getting a client up and running on your solution, just seeing the conversation that a clinician can have, clinician to clinician versus me, it was just eye-opening, right? It's something that probably should be obvious, but it took me kind of being in the throes of trying to scale a company where I realized we need two people that are talking the same language to really get this effectively. And then the other thing that's, powerful about that is whomever we're dealing with on the client side is just 1, 2, 3 people out of hundreds that are eventually going to touch the system. So we need to also build internal advocates that can then explain it and help disseminate the information throughout the organization. So I'd love to say that it was forethought and a well thought out strategy, but it really was experience getting in there and just seeing the power of having somebody with a clinical mind help us, not just with our product, but also making our clients successful.
Yeah, I mean, arguably, as you said, forethought would be great, but building it off of experience, seems implicitly like it would encourage you to, adopt it and incorporate it in a way that is responding to kind of pain points or issues that you're observing, as opposed to just plopping it in and maybe not effectively utilizing it because you were putting it in with blinders without being fully cognizant of how it would be beneficial.
You're absolutely right. And when I advise or other healthcare tech companies that are certainly in the earlier stages, and I can see that it's a lot of really aggressive, excited technologists, I encourage them, whether it's hiring on a full-time basis or getting a fractional resource, get somebody with the clinical mind in the vertical you're in involved very, very early. And that's easier said than done because, as you know, in the early stages, resources are tight. So the thought of spending money on just advice sometimes is a little challenging, but it'll pay dividends in the end. You'll build things that are relevant. You won't have rework. and then you'll ensure success when you get to the point of implementation, because it's always harder than we think it is.
And kind of as you pursued that alignment and bringing in that different expertise, was there any insight or kind of suggestion that really surprised you that, just because as you pointed out, you're coming from a different training and different experience that you wouldn't have thought of and made a significant positive impact on what you're developing?
Yeah, I mean, listen, I think in general, what I've always found, and I'm still surprised to this day when I'm in discussions, is the simplest things that we think we're asking clients to do in our software. For example, let's say we insert a step. So instead of there being 2 clicks to get to this endpoint, there's 3, but the value is astronomically greater. You think, well, geez, well, of course we would do that extra step. But really understanding what's going on at the point of treatment, you can all of a sudden realize that there isn't that time for that extra click, or it's a distraction, or something that's in reality of what's happening that actually, makes you consider, do we want to do that even though the benefits are so much greater? I'm continually informed on that today. Every time we're in talking to, what a different specialty or a different acuity of care, it's really fascinating to understand that what seems simple from a technology perspective can have an impact, really adverse impact on the workflow and the care that happens within.
Yeah, no, it's a really insightful comment because, as you said, it's, from the technology perspective, it's really easy, as you were describing, to think, oh, it's just one simple click and it can open up all of this potential opportunity. But, if you think, if you come from that approach without being intimately familiar with the workflow that you're trying to implement into, that click is, as you were just saying, not necessarily that same impact when you're in kind of a practical real world setting as opposed to the development stage.
That's right. And not to go off on too much of a tangent here, but, think of it as like a high performing athlete. Part of what makes an athlete successful is not just their, physical domination of the sport, but it's the mental mindset they're in at that point in the game or the match. I look at providers the same way, right? They're in a certain mindset as they're thinking about something. So if you're asking them to do something that may disrupt that, it seemingly to us is, well, geez, I'm just asking you to click another button. But if they're thinking about something totally different, it takes them outside of that mindset they're in, and then they have to go back into it. Those are things that, I never appreciated until I started to work with nurses and doctors much more and understanding what really happens when they're with a patient.
Yeah, and as I said, I don't know if that's necessarily a tangent so much as really underscoring the fact that it's, oftentimes it can be easy to lose sight of the fact that a lot of the technology solutions are designed to be enhancers and drive more efficiency and enable better interaction between clinicians and patients. And if you as you just said, if you interfere with that or you break the zone that you can get into, now you're not enhancing, you're interfering with the delivery of care.
That's right. That's right. And it's just so important for us to, you can just imagine, you think about all of the healthcare technology companies that are today supporting the healthcare industry or looking to support the healthcare industry. Not a lot of them probably have that viewpoint or that insight. And so it's something that is really important. And it's even becoming even more important because of the pace of change that we're seeing in healthcare. Obviously, part of that powered by, the inflection point that we have, in terms of technology disruption. We can go faster, right? We can go faster than we ever could before, but we have to keep our eye on, acknowledge the realities of what actually happens in healthcare systems in the, whether it's the patients discovering or getting to that point of treatment, and then obviously, what happens in the care setting. So it's something that, I think is often overlooked and is pretty dangerous to overlook right now, as things are changing at such a rapid pace.
Yeah, that's a very important piece to call out, which is, it's yes, things are evolving quickly and very rapidly, but you can't just allow that to overtake the thoughtfulness around the approach that you're taking. But Matt, believe it or not, we're already almost out of time. So I'm going to kind of pick up on that and pose one final question, which is, as things are evolving quickly, what do you anticipate is going to have the biggest impact, from a technology or a development perspective on care interactions and delivery in the next, like 1 to 2 years?
Yeah, I'll probably go back to, we could do a whole podcast just on this question, but I'll probably go back to what I just said in terms of the pace of change. It's really going to push the industry to do some of the things I talked about before, which is, is it going to be, perfect and catch up to the speed of technology change? No, but what I'm seeing is that there's a willingness of our healthcare partners to embrace this inflection point that we're at, that's driven by, a lot by AI right now. It's going to really accelerate things. I think the next 24 months, we're going to see advancements in healthcare that we haven't seen in decades. And AI at the core is really going to do that, not only in terms of the speed on which we can bring solutions to market, but going back to what Dexcare does, we connect large amounts of data across different systems, and we're able to create insights out of that. And we're increasingly being able to do that on a proactive basis versus reactive. And you could argue that there's enough change just in terms of getting that information in real time. But now with our ability to process it with AI, we can start to suggest things before they're coming to the surface. It's just a pace of change that's just unlike anything that we've seen. And so I think I know it feels like every few years we say the next couple are going to be the most significant change, and they usually are. But I think the amount of change we're going to see in the next 24 months is going to be pretty incredible. Everyone's going to benefit from it. Patients, providers, as well as systems overall.
Yeah, no, I think you're right, and probably a lot to be able to keep track of. But as I said, believe it or not, we are already out of time. And I want to thank my guest, Matt Blosl, for a great conversation today.
Thanks for having me. This was enjoyable.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.